Hi everybody, good morning. My name is Shaina Sabak. I'm going to be giving an oral presentation on the assessment of the head and neck. I'm going to be collecting the objective data. So the first thing you want to do is you want to gather equipment, which is the gloves, flashlight, the pen light, glass of water, and a stethoscope. Then after that, you're going to be demonstrating courtesy to the patient by introducing yourself and explaining the procedures to the patient. After that, you're going to do your hand hygiene and give the patient privacy to change to his or her gown. So now let's get on to the actual examination. So the first thing we're going to inspect and palpate is the head and face. We're going to inspect the head size, the shape, the facial appearance, the configuration, and involuntary movement. You want to see if the patient's type, the shape is long, wide. You want to know if there's any types of sloopiness or any types of things in the face. The size of the head is the size of the head abnormal, or is the shape, oval, round, or whatsoever. And then after that, you want to palpate the head like this for consistency while wearing gloves. You always want to make sure that you're wearing gloves when you're going to touch the patient's head or face. And then after that, you want to inspect the face for symmetry, the features, the movement, the expression, and the skin condition. You want to see if there's any lesions, or is there any acne, or is the condition good? Is the face aligned? Is there any sloopiness, like I mentioned before? And I also forgot to mention, while palpating for the head, you want to check if there's any lumps or bumps. Is it thick, smooth? Is there any types of dandruffs, or is there any manifestation of insects? And then you want to palpate the temporal artery here for tenderness and elasticity. You want to see if it's swollen. How does it feel? Does it feel normal or not? And then after that, you want to palpate the temporomandibular joint for the range of motion. You also want to check for the swelling and tenderness, or crepitation, by placing the index finger over the TM and palpating the joint as the patient opens and closes his or her mouth. Then after you do all that, you want to document any findings that you have observed. And then now we are going to go for the neck. When you're inspecting the neck, you want to, while it's in a neutral state, you want to slightly extended position for symmetry and for presence of lumps and masses. So you want the patient to lean to the right, like that, or like that. You just want to check the neck if there's any lesions, any rashes, any lumps, bumps, or any findings. Don't forget to document them. And then after that, you want to inspect the movement of the thyroid and the cartilage and thyroid gland by having the client swallow. That's why you have your glass of water. You want your patient to swallow the glass of water and see how it moves. Is it normal? Does it extend? Is it okay? You also want to inspect the cervical vertebrae by having the client flex the neck, like chin to chest, like this. You want to see if the patient is capable of doing so. After that, you want to palpate the trachea area by placing your finger in the sternal notch, feeling to each side like this. I think it's here. And then palpating the tracheal rings. After that, you want to palpate the thyroid gland. First one, you want to go to the right lobe by sliding your fingers to the right and just place the trachea to the right. And also be prepared to palpate the gland as the patient swallows. Then you're going to go to the left lobe by sliding your fingers to the left, gently displace the trachea to the left, and doing the same thing. Now for the posterior approach. Well, that was the anterior approach, the one I just mentioned just now. But now for the posterior approach, for the right lobe, it's the same thing, and for the left lobe, it's the same thing. Then you want to note any findings. And for osculation, we're going to osculate the thyroid gland for any roots. If the gland is enlarged or if it's expanded or palpatable, you want to use the stethoscope. Document any findings. And then after that, for the palpation for the neck, you want to lightly palpate the neck for occipital nodes, the back of the head at the base of the skull here. You want to check if there's something there. You want to palpate for any lumps and bumps. And then for the posterior, it's behind the posterior auricular nodes is behind the ears. For the preauricular nodes is in front of the ears. The tonsillar nodes under the mandible. Then you have your submandibular nodes in the angle of the jaw, your submental nodes, your superficial cervical nodes, your posterior nodes, cervical nodes, your deep cervical nodes, your supraclavicular nodes, and your infraclavicular nodes. You want to have that, by palpating lightly. That's what you're gonna palpate for. You're gonna palpate for any swelling, any types, anything that you can find, something that is not normal. You wanna palpate just to check on it, check if everything is normal, and so after that, you want to document all your findings. Tell the patient that you're done with your findings, and then you're gonna have the doctor see the patient later on. So that is how you do a head and neck assessment, and that's for collecting the objective data. That is all. Thank you.